Hey everybody, Dr. Brace here. It's Facial Plastics Friday. I just got back from Guelph General Hospital. Sitting outside and it's a little windy. Apologize for that. But today we had a good day. It was more of a general head neck surgery day for me today. And so first case we did was a very large goiter thyroidectomy, followed by a parathyroidectomy for somebody with a parathyroid adenoma. So their calcium was out of control. And that same patient had a large basal cell on their head that I removed and did what's called an A to T flap reconstruction, which is just a local rearrangement of the tissue to close up the hole and prevent the eyebrow from looking lifted in that surgery. When you reconstruct it, you want to keep things kind of where they are as much as you can. After that, I did a sinus surgery for a patient of mine that had a very large polyp inside their cheek sinus that was causing some breathing issues, and then another sinus surgery for a patient of mine who is a diver. Was a photographer, underwater photographer, has to fly all over the world, has to be at pressure underwater, and was having a lot of barotrauma or pressure issues with her sinuses. And so why do I say all that? Well, on Tuesday, we posted about the specialty of otolaryngology. And otolaryngology is what I originally trained in Halifax at Dalhousie University, and that's the specialty of head neck surgery. So I spent 5 years training on neck surgery, mouth surgery, throat surgery, facial surgery, eyelid surgery, nose surgery, ear surgery, and kind of how they're all interrelated. And then after that, I went on to Ohio State University to do facial plastic surgery. So sometimes people ask, I thought you were a plastic surgeon. And the answer is, I'm not a general plastic surgeon, I am a facial plastic surgeon. I only do cosmetic and reconstructive surgery of the face, but I also do functional surgeries like the neck surgery that I did today, like the sinus surgery I did today. And the reason I continue to do that and I haven't dropped all of that is, well, there's a number of reasons, but one is that I don't want to ever be uncomfortable working in the neck. And so when I do a neck lift and I'm removing gland and muscle and fat, there's a lot of big arteries in there. There's a lot of important nerves in the area. And I don't want to lose those skills. I want to be able to continue to be comfortable operating in the neck, comfortable dealing with any complications that might arise during a surgery. And so I find that keeping my skills sharp by continuing to do head and neck surgery makes me a better cosmetic surgeon. I also do a lot of functional nasal surgery, septorhinoplasties, septoplasties, partial septorhinoplasties, and the sinuses are an integral part of the breathing, and removing large obstructive polyps or helping things aerate better in the sinus helps patients breathe better. For similar reasons, using endoscopes, being in the nose, dealing with things helps me be a better cosmetic surgeon, because I can then use those tools and those techniques to be able to help somebody with cosmetic goals. And so what's the difference between a plastic surgeon and a facial plastic surgeon? Really, it's the 5-year residency. A plastic surgeon will train in reconstruction and cosmetic surgery of the whole body, hand surgery, facial surgery, breast surgery, tummy tuck surgery, lower limb reconstruction, skin all over the body, nerve surgery. Often a plastic surgeon that does that training will specialize in one of those areas. A facial plastic surgeon has spent 5 years training on just the face, and then does another year or 2 years subspecializing in the reconstruction and the cosmetic surgery of the face. And so that's really the difference. We both do nerve surgery, we both do skin surgery, we both do cosmetic surgery, but the training, the background, the kind of expertise in the regions varies a little bit differently, because we are concentrated here as facial plastic surgeons, and a plastic surgeon is trained for the whole body. So can you get a great facelift from a plastic surgeon? Yes. Can you get a great facelift from a facial plastic surgeon? Yes. Can you get a great breast lift from me? No. Can you get that from a plastic surgeon? Yes. And so my practice is focused just on the neck, just on the face, the nose, otoplasty for the ears. I don't do any more hearing surgery. I don't do any tonsil surgery, throat surgery anymore, but I do neck surgery in terms of salivary glands and endocrine glands. I do nasal surgery in terms of sinuses and reconstruction, and I do trauma surgery, reconstructing broken facial bones, and helping people look and function better. So that's Facial Plastics Friday for today. I hope that clears up the differences and some of the nuances between the specialties. I have a lot of friends who are plastic surgeons, and they're fantastic surgeons. Sometimes there's some petty rifts that develop between the two specialties, and I'm not about that at all. I really enjoy working with my plastic surgery colleagues here in town, and from McMaster and in Toronto when I was at Clinic 360. I think we can learn a lot from each other. I love working with plastic surgeons on our Ukraine trip, because everyone brings a slightly different perspective to our patients to give them the best result possible. Everybody have a great weekend, and have a happy Facial Plastics Friday.